I'm with the Portland, with PSU's Center for Public Service, and I have the pleasure to have been working with this great team. And tonight, the Consulate of Japan here in Portland is not just a sponsor of this event, it actually was their idea, and it's through their leadership that this whole event tonight has come to fruition. And I'm just super excited about it. And to kind of explain what a consulate is, every country has an embassy. So they have a Japan embassy in Washington, DC. And then they have 17 consulates around the country. And we're very lucky to have a consulate here in Portland. And inside of each consulate, they're run by the head person is the consul general. And then they have some number of one to many consuls. And the consul, the person responsible for this, and these are typically experts and diplomats and whatnot, but this particular person is asked that I not recognize his name, but he's been the person that put this whole thing together. And I just personally want to say thank you to him. And it all began when we were drinking beer, when he first came to Portland a few years ago. And he said, we were talking about what Portland can learn from Japan. And I said, well, I had been after the 2011 triple disaster in Japan, I did some research over there. And after that, I was invited by the consulate of Denver to give a speaker series. And then after that, I went to Jamaica to give a lecture series there about the synergies between sustainability and resilience, these two things. And this person who I keep wanting to say his name he said, well, let's just see if we can take that to the next level. And I said, that would be really an exciting thing. So we took this, we said, well, going to the next level would be what? So we had the synergies of sustainability and resilience. And I said, well, Japan has been working on aging sustainability and resilience. And in fact, their home energy network is called the EcoNet, which stands for the Energy Conservation and Home Care Network. So that's been in process for about 25 years, and with the intent of bringing energy, the resilience, and aging and being safe at home together. And I was saying that, and this unnamed person, he says, well, let's just do something. And he goes, and I go, wow, that would be okay. And he goes, we want to take this to the next level, he said. So we decided we'll do something. And then it was just kind of an idea. And then a few months later, I get a message from him saying, we have the opportunity to bring one of Japan's leading gerontologists to Portland virtually, and she's going around all over the world and the country giving this presentation. And he says, but most of the other consulates, they're just doing the normal presentation. And this person said, we want to take that to the next level. So he says, I want to do something that engages the people of Portland more than just a simple webinar. So he said, let's do something. And that's what we did. And that's what we're here today doing. And I'll introduce the team in a few minutes. But first, we have the person I want to thank the most that I can mention his name, and that is Consul General Shiga. And Consul Shiga is now going to give us a greeting and welcome. And again, Consul General Shiga, thank you so much for what you've done to Portland. So please give us your greeting.
Thank you, Dan. Hello, everyone. I'm Masaki Shiga, Consul General of Japan in Portland. Thank you for making time in your busy schedule to join us today. Over last decades, responding to the needs of an aging, long-living population has become a very significant theme in Japanese society. I would like to thank Dr. Akiyama for taking time away from her many projects in Japan to join us to discuss this important topic. We are honored to have your expertise. We are pleased to be able to hold today's event in collaboration with Professor Akiyama, the Portland Bureau of Planning and Sustainability, and the Portland State University Center for Public Service. Our sincere gratitude goes to everyone involved organizing this talk. And in Japan, there are many examples of investing in social structures, including digital technologies, to help create an inclusive, sustainable economy and society. And if you are joining us today and would like to learn more specifics about ways in which we are addressing such challenges as an aging society, the construction of green, livable cities, environmental stewardship, or if you have ideas about ways Japan and the United States can exchange knowledge and collaborate on these issues, please feel free to contact us. We hope that today's event will be a catalyst for US-Japan cooperation on this and other important related topics. Thank you again.
Thank you, Consul General Shiga. That was great. And again, my personal thanks to you and your staff for not just sponsoring this, but being the guiding leadership behind this whole thing. And before I introduce our first panelists, we have a couple of housekeeping rules with the Zoom webinar. You may see some buttons on the bottom of your screen. The only one that really does anything is the Q&A button. And when you push that, you can type in a question that will go to our curators in the back that are looking through all these questions. Nobody else can see those, but those are to ask questions, to have our panelists ask Dr. Akiyama Sensei during this thing. The raised hand button, it looks like it works, does nothing. Don't worry about that. And without further ado, I want to, let's see, what else? Picking up where we left off with how when the person I can't name said, well, let's take it to the next level, I go, that's great. Unfortunately, I'm not the right person. But don't despair, I know the right people. And the person I just happened about a year before had met our panelist here, and he said, and he's exactly the right person. And I said I knew him, but I didn't really know him. I met him once, but I knew somebody who really knew him. And she is the head of First Stop Portland and a very active part of the Center for Public Service. And they're now they're hosting this whole thing. And I go, I keep wanting to say this guy's name, but I said, we got a team for you, and we put this thing together. And that person, our expert, the anchor intellectual of our whole team has been Alan Deletori. And he describes himself as an urban gerontologist, and an urban gerontologist. That sounds like something. Somebody I'd want to meet. And he's so good at crossing boundaries. He's the perfect person to head up this activity here. And he's grown up as an age-friendly scholar since 2006 is what it says here. And I'm thinking, Alan, that was when you were in high school, perhaps? I'm not sure. That's a long time ago. And anyway, just before the pandemic, we moved away from academia and joined the city of Portland in the Bureau of Planning and Sustainability. And he's recently kicked off an age and ability friendly neighborhood center park project, which I think is going to be transformational. And tonight's presentation is going to be part of that transformation. And without further ado, Alan, take it away.
Thank you, Dan. I want to first say thank you to the full team, to the folks at Portland State, to the consular's office. This has been an amazing opportunity to work together and to think about some solutions. A little bit of background here. So in 2006, the World Health Organization reached out to the other panelist, Dr. Margaret Neal, who I will introduce in just a moment, to see whether we were interested in joining a global study, 33 cities in 22 countries around the world. Japan was also represented in that study. And we quickly grabbed the opportunity. We felt like this was a great chance. Margaret at the time trusted me, Dr. Neal trusted me at the time as a graduate student to take on a lot of the research and analysis. And together we were able to do a lot of good work around shaping some of the directions for age-friendly programs locally. Today, both Portland and Multnomah County manage age-friendly programs. And as Dan mentioned last month, we launched a new age and ability friendly neighborhood centers project It's really intending to be a place where we can concentrate mobility options, housing, services, and create good places to grow up and grow old in our city. This is an exciting opportunity for me to introduce Dr. Margaret Neal. She's a mentor, she's a colleague, and she's a friend, and someone who I hold in the highest regards personally and professionally. Margaret is a professor and director emerita from Portland State University's Institute on Aging. And I want to note that the PSU's Institute on Aging has been instrumental in allowing this age-friendly initiative to grow and move forward. We're indebted to the university and to the Institute itself for the work and the support that they've given over the years. Dr. Neal is the founder of our Age-Friendly Portland initiative. She serves as Portland's point of contact for both the US and the global networks around age-friendly cities. She's an expert in age-friendly program development and family caregiving, and she leads our current committee on age-friendly employment and economic development. Dr. Neal co-organized a keynote session at the International Association for Gerontology and Geriatrics in 2007, where she presented alongside Dr. Akiyama. So without further ado, I'd like to introduce Dr. Margaret Neal.
Thanks, Alan. It's a great pleasure to be here. And I want to thank also the team, Dan, the Consul General, and it is my great pleasure and honor to introduce Dr. Akiyama. Professor Akiyama is a gerontologist. She is a professor emerita at the University of Tokyo and the former vice president of the Science Council of Japan. Professor Akiyama has conducted a number of cross-national surveys and is widely recognized as an expert on issues of global aging. She's known for her long-running research on the elderly in Japan, tracking the aging patterns of approximately 6,000 Japanese elderly over 30 years. She has also initiated a number of social experiment projects that pioneered the redesign of communities to meet the needs of Japanese highly aged society. And more recently, the Kamakura Living Lab, which is a platform for open innovation by co-creation among users, industry, government, and academia. She started the Institute of Gerontology at the University of Tokyo in 2006. She received her PhD in psychology from the University of Illinois. Thank you for being here, Dr. Akiyama.
Thank you for the invitation and also kind introduction. Let me see, my face is too big. Let me just adjust. Well, aging population is a global phenomenon, so we are all in the same boat, and we face various problems at national level, community level, and the individual level. And this is my great pleasure to have this opportunity to share our ideas and social experiments in redesigning communities for the aged society. And let me share the screen. Okay. Okay. Institute of Gerontology at the University of Michigan. I'm sorry, I mean, I was at Michigan, so still I said Michigan, but University of Tokyo, where I am affiliate, is interdisciplinary research institute. And the researchers in medicine, nursing, pharmacology, engineering, economics, law, sociology, psychology, and education work together. And my academic background is social psychology. So I have always approached issues in aging society from a place of ordinary citizens. In my view, our challenges and opportunities in 100 years life society are condensed in these three issues. For individuals, we need a new life map, a life design, for 100 years. For society, redesigning the hard and soft infrastructure to meet the needs of 100 years life society. And for industry, 100 years life society is a gold mine of innovation. The focus of my talk today is on the second issue, the redesigning a community for aged society. Well, I'll start with a brief description of the background. Japan is one of the frontrunners of rapidly aging societies. The average life expectancy of Japanese women is now 88 years and 82 years for men. The current total fertility rate is 1.34. As a result, 29% of the Japanese population, more than 1 of 4 persons in Japan, is age 65 and older. The total population started to decline at year 2010. And as you see, the working age population has been steadily decreasing, and the population age 65 and over, particularly age 75 and older, increasing. This slide shows the old age dependency ratios. In 1965, 50 years ago, there are 9.1 persons to support 1 older person. Now the ratio is 1 to 2.4, and we are expecting the ratio will become almost 1 to 1 in 2050. Obviously, we will not be able to sustain the social security system and the national economy as well. Social welfare spending for pension, healthcare, and long-term care has been steadily increasing. Although this is an important issue, I will not focus on macroeconomic issues today. In year 2030, it is predicted 20% or even more of the population age 65 and older are demented, and 45% will be living alone. This is a new phenomenon in Japan and in Asia in general. I mean, traditionally, Japanese elderly lived with the children's family. As Dr. Neal mentioned, we have been conducting a panel survey following about 6,000 Japanese age 60 and older, basically every 3 years since 1987. Looking at the changes in major domains of their lives with increasing age, health, economic status, and social relations. So we conduct face-to-face interview basically every 3 years. And, last year, we collected 10th wave of data. Using ADL, activities of daily living, and instrumental activity of daily living, IADL, limitations, we looked at the changes in independent living with increasing age. It is a functional independence, a key concept of the WHO definition of healthy aging. And this is the scoring guideline. We gave score 3 to people who have no ADL and IADL limitations. We gave 2 to those with ADL, no ADL limitations, but need assistance for IADL activities. And score 1 is for those who need assistance for both ADL and IADL, and zeros are dead. And using the latent class analysis model, we found 3 typical patterns of health change among men. The point I want to make in this graph is this the red line, okay? And 70% of men stayed functionally independent until mid-70 here age, okay? And then their health gradually declined and required some assistance. This is a similar graph for women. 70% of men and 90% of women. Altogether, 80% of Japanese older persons start losing physical independence in mid-70s. The population age 75 and older is rapidly increasing and double in the next 10 years. So these trajectories pose a serious problem. This is cohort difference in frequency of contacts with non-family members, such as friends, neighbors, and relatives. You see the women in later cohorts reported less social isolation, but the men's trend was in the opposite direction. This is a common phenomenon in urbanized societies. Weakening human bonds, particularly among men, is an issue we need to address. In 1980 and 90s, computer technology rapidly advanced. It was an exciting time in the field of survey research. The advancement of computer technology made it possible to analyze large and complicated data. I was at the Survey Research Center at the University of Michigan and engaged in a number of cross-national surveys and panel survey on a large scale. Our purpose was to understand changes associated with individual aging and population aging and identify issues we need to address. In 1997, I returned to Japan. The Japanese population was rapidly aging. What I felt was, we already know what issues are. What we need now are solutions and actions. In my view, one viable approach from the academic community was action research. The purpose of action research is to solve a particular problem and to produce guidelines for best practice. It is a participatory research in collaboration with multi-stakeholders, such as government, industry, various organizations such as NPOs, Physicians Association, and certainly citizens. It takes a spiral steps. Each step is composed of a PDCA cycle, that is planning, action, and fact-finding about the result of the action. University can offer a platform for action research, the collaboration of multi-stakeholders who jointly seek solutions to a particular issue. It will turn out to be a platform for open innovations. Action research is a promising research method, but still at the formative stage. We need to work on further developing action research as a rigorous scientific research method. Among various issues in the aging society, we identified 3 priority issues we take actions. The first, we need to make individual and collective efforts to shift this point. I mean, the point is the people start experience declining, the independence. So the first one is to shift this point toward this direction. Okay. In other words, we need to increase years of life without a disability. The second, even if we could add several years of life without disability, the majority of people will still become to require some level of assistance. Therefore, we need to create an environment where these people stay safe, comfortable, and connected. Third, we need a strategy for forming and maintaining human bonds. To address these issues, Institute of Gerontology at the University of Tokyo launched a social experiment in a community. The existing infrastructure of communities was built when the population was much younger, and we need to redesign both hard and soft infrastructure of communities. We are trying to redesign communities for meeting the needs of the highly aged society. We want to build communities where people could live for 100 years, staying healthy, active, connected, and live with a sense of security. And this is not a retirement community. It is an ordinary community for people of all ages. As this is a social experiment, we evaluate the effects of our interventions at individual level and community level and cost. And we make policy recommendations based on scientific evidence. And this is an overview of our project. It requires a considerable scientific and also social innovations. So these are the major projects we're working on. We have 2 experimental sites, one in the metropolitan area, 30 kilometers away from Tokyo, and the other in rural area. We chose 2 quite ordinary communities so that they can be helpful for other communities in redesigning their communities. The following slides illustrate major projects we are now working on in Kashiwa, the urban community. The first project is a workplaces for the second life. We live longer and we work longer. As you might remember, this is the title of the OECD report published in 2005. We are not only live longer, but also live healthier. This slide compares the usual walking speed of people in the same age groups from 1992 to 2017. As you see, men and women in all age groups significantly improved in walking speed. The changes are amazing, particularly in the people in 80s and over 80 years, or 80 years old. Also, the current seniors are better educated compared with the previous generations. My apologies for the notation in Japanese. So this graph is based on 2015 census data. So, let me see. This is the cohort, born in 1920s. So they were over 90 years old at census time. Okay, and the youngest cohort were born in 1980s. So they are in their 30s. Well, this graph shows here, 43% of men and 48% of women with the oldest cohort who were born in 1920s finished only elementary school or middle school. But here in people in 60s now, okay, 11% of men and 9% of women of the 1950 cohort in their 60s finished only middle school. So Japan has 9 years of compulsory education since 1948. And the blue part are high school graduates, and white parts are graduates from junior college and vocational schools. And the black part, okay, here are college graduates. The college graduates significantly increased over the years. Okay. 4 years ago, Japanese Association of Geriatric and Gerontology made an official pronouncement to raise the definition of old age from 65 to 75 years old. 3 years ago, we conducted a survey asking 5,000 people aged 50 to 64, so kind of pre-seniors, what they want to do after age 65. Japanese, the number one, over half of the respondents mentioned they want to work full-time or part-time. Number two was learning. So Japanese seniors are willing to work. According to the national survey by the Cabinet Office, 70% of people aged 60 and older wish to work until 70 years old. Almost 40% said they wish to work as long as they are capable to work. This is a graph in the report published by Ministry of Health and Welfare. It shows the labor participation rate of Japanese, the graph shows, the labor participation rate, of seniors age 65 and older, and the medical care expenditure, individual level, okay? And by prefecture, like, province, have moderate correlation. Expansion of job opportunities for seniors is essential to ensure sustainability of the society, to maintain and enhance the labor force, social security, finance, and economic development. The prediction of labor demand and supply in 2030 looks bleak. We lose 8.45 million workers in next 10 years. Seniors needs to be producers, workers. And the social benefits exceed 100 trillion Japanese yen. Seniors needs to be taxpayers and promote health and contain medical costs by working. Expansion of senior market is also important. Seniors will be active consumers. This is an important issue at societal level, and there are obviously a number of macro policy issues to address. If we work until 75, the old age dependency ratio will considerably change. People wish to work even after age 65, and work is good for health. So we started a project called Workplaces for the Second Life. Kashiwa City is a typical bed town of Tokyo. A huge number of baby boomers who commuted to work in Tokyo retired and came back to this community. We are creating age-friendly workplaces and a flexible scheme of employment suitable for the second life. We created workplaces in 9 fields. 3 are in agriculture, 2 workplaces are food-related, and the others are in the field of education and personal care. This kind of the job places, it depends on what kind of resources in that particular area. Okay. All workplaces are operated by business owners in the private sectors. The wage varies depending on the nature of work, but the minimum wage is guaranteed for all jobs. Older persons are diverse in terms of physical abilities, free time, economic situation, and the lifestyle, and also the skills as well. Using our work sharing, we develop a flexible employment scheme for both employers and senior workers. Older persons decide when and how long they work. We offer the job seminars, a kind of orientation program for designing the second life. These are senior workers at work. And many of them, they chose the job totally different from their first job. It is essential for senior workers to learn the basic ICT skills for at least participating in the job sharing group. We evaluate the effects of working after retirement age at the individual level and the community level. These are some of the indicators, including smile, the changes in smile. Along using these devices, we assess physical abilities, cognitive abilities, social interactions before they start working, 6 months, 12 months, 18 months later. We are still, collecting data, but the preliminary analysis results show the positive effects of working. Based on the scientific evidence from a community experiments, and we made policy recommendations to the national government, Ministry of Health, Labor, and Welfare. Based on our policy recommendations, in 2017, the legislation was passed at the national diet to institutionalize the program, the kind of similar program. And this is the guidebook we published for disseminating the program to other communities. Now it is spreading throughout the country. Seniors' labor force participation is essential for sustainability of the social security system and economy as well. We need to reform the pension system, reduce various barriers at workplaces, and enhance seniors' employability. Also, I mean, one of the barriers, not only physical workplace barrier, but also we need to eliminate ageism as well. We also test various products which provide older workers with safe and productive work environment. One example is a simple power assist device for reducing the stress on the lower back in farming and nursing care, developed by Hokkaido University and the Mitsubishi Electric Company. We are now working on a platform for job matching assisted by AI with a major employment agency, Recruit, and IBM. For a long time, we made individual and collective efforts to extend life expectancy. When the average life expectancy approached 80 years, the focus shifted to the extension of healthy life expectancy. Now we are about to seek extension of years being engaged in the society, the extension of engaged life expectancy. The next project is frailty prevention. In the highly aged society, frailty is a dominant cause of disability. We promote frailty prevention in the community. We try to raise awareness, awareness of physical frailty, cognitive frailty, and social frailty. And this is a longitudinal cohort study on a large scale. Trained active seniors in green shirt participate as staff member in the annual frailty checkup in the community. And preliminary analysis of the data indicates social frailty often precedes physical frailty and cognitive frailty. Therefore, social engagement is an important factor to prevent frailty. Just I'll go quickly. The next project, the primary concern of older persons is health and long-term care. The national government is promoting the integrated home-based care system, which provides home-based health and social care services for 24 hours. This flower pot picture illustrates the concept of the system. 6 components are conceived to make up the system: medical care, nursing care, and rehab and prevention. These professional services make up the plant part. Social care services supporting daily life, such as shopping, cleaning, and transportation, is the soil part. The housing constructs the flower pot part. The last but not the least important is the patient's choice and preparation, the tray. This is a slide illustrates more concretely the concept of the person-centered integrated community care system. When we built the system, the first hurdle we had to clear was doctors in private practice were reluctant to be on call for 24 hours. Most of the doctors in private practice run an office with one doctor, a couple of nurses, and staff members. So on call for 24 hours means he or she cannot go to professional meeting, take vacation, nor even enjoy a glass of wine with dinner. So we propose doctors form a pair of primary doctor and sub-doctor in the area, but they did not like it. They are concerned the patient might switch to sub-doctor. So the current system is one doctor stationed at the local health hub is available to serve as a sub-doctor to all clinics in the area. Then they collaborate with other service providers, such as care managers, visiting nurses, dentists, PTs, and home helpers. When we started, we formed 5 working groups. The first one was Vision Working Group, which set up workable relations among primary doctors, sub-doctor, and doctors in hospitals. The second, Coordination Working Group, coordinated healthcare and long-term care services. The third, the Trial Practice Working Group, tested and verified the system by trial runs. The fourth, Hospital Working Group, defined discharge protocol and backup system of home-based care. And finally, the face-to-face the working group, where all service providers in the area get together and enhance the partnership. Actually, the picture in the left side, the people exchanging business cards. So those people in different professions had been working in this area for a long time, but they did not know each other. So this is a training workshop, for health and long-term care professionals on the home-based care. We mix lectures, workshops, and practicum at a home visit situation. Four years ago, a combination of independent assisted living facility was built in the central part of the community. Various service stations for home-based healthcare are located on the first floor of this building. They are the offices of doctors and dentists who make home visits, and visiting nurse, PT, and home helper stations. And the pharmacy delivers medicine to our patient's home. All of them deliver the services not only to the residents of this facility, but also the residents of surrounding community. This is a picture, a doctor and a nurse visiting a patient's home. And my mother passed away, at age 97, 3 years ago. And I remember, she received the home-based healthcare like this, for the last 2 years. She stayed home and just continued to their everyday life. I thought it's that was a very good experience for her. This small-scale multifunctional service center provides daycare service and short stay for respite care, mainly for caregivers, and home visit by a nurse or home helper responding to the patients and their families' needs. This type of service center is very user-friendly and in great demand. The integrated community care system is a patient-centered care system, and cooperating with hospitals, social care services such as mobile meals and transportation services in the area. It provides total care in the place the patient resides. The information network system is quite important in the patient-centered home-based care, which requires coordinated efforts of various healthcare professionals and social care providers. This system provides a common infrastructure for information sharing among the existing data system. In Kashiwa, like in most cities in Japan, hospitals, clinics, visiting nurse stations, and nursing homes use the data system made by different vendors. They could not share the data because the data are not compatible among different systems. So this system allows data sharing among different data systems being used by healthcare and long-term care service providers in Kashiwa. And we published a guidebook for promoting the Kashiwa model of the integrated community care system. Okay. Well, transportation is a big issue for older persons to stay safe and active. And this is particularly in rural area. This is particularly it's kind of serious in rural area. In collaboration, excuse me, let me get some water. In collaboration with several companies such as Toyota, we are working on alternative means of transportation in the community. We maximally utilize existing ICT to reach out for people to stay healthy, safe, and connected. We also pursue technological innovations and test new technology in the community. This kind of a social experiment requires not only the collaboration of researchers in different disciplines, but also full collaboration with local governments and healthcare institutions, NPOs, business community, and residents. Action research is a promising research method in gerontology, but as I mentioned, still in the formative stage. We need to work on further developing action research as a scientific research method. 3 years ago, we published an introductory book of action research in aging society in Japanese. I hope action research gets citizenship in gerontological research and contributes to the solutions for formidable challenges in rapidly aging society. The population aging is a global phenomenon. By taking up enormous challenge and exploring new opportunities in aging society and building sustainable society together is our global goal. Thank you for your attention.
Thank you so much, Dr. Akiyama. Our first question relates to the concept of population aging as a human success story. We understand the many challenges associated with an aging population, especially a super aging society. But could you talk a little bit about any positive aspects of that super aging society?
Okay. Well, I think, the super aging and also 100-year life society has been they bring great new opportunities for individual and also industry as well. Okay, and in Japan, there for several 100 years, it says 50 years life society. Okay, we have 50 years of life. Okay, now we're talking about 100 years. Okay, so it's kind of doubled. And so, so we have, the opportunity. So we live, twice long. Okay. So we can do a lot of things. So this is kind of new opportunity. Which our grandparents' generation never even thought about. Okay. And also the trend in Japan I see is when we talked about 50 years life society, the people's life course was set, okay? And where women have to marry before age 25 or something, okay? And they have children underage. And for men at that time, as soon as you finish the school, you get a job. And then, work at the same place until retirement. Okay, and but now I think we have a lot of freedoms. We can design our, each person can design our life, and also handle. If it doesn't work, you can switch the other way. So this is a really a new opportunities, and in order to make that possible, I think industry and also the social system we need to change. So that is a new opportunity, I think. Yeah.
Thank you. Thank you very much. You talked about multifunctional service centers, and based on some communication we've had previously with Japanese partners, we've learned that older adult daycare centers in particular are more prevalent in various areas of Japan than they are in the US. What are the benefits of having many older adult daycare facilities in a city?
Okay, I'm sure, I think daycare centers or daycare services are available in the United States as well, I believe. Okay, but this is kind of essential. It's I think playing a very important role for the home-based care system. Okay, and my mother, I think we went to a daycare center 3 times a week. Okay, from 9 o'clock to 4 o'clock or 5 o'clock. Okay, and I think where the elderly themselves, frail elderly themselves, I think they have if get together, so they have social relations, interactions, and also physical exercise or some art activities. There are various activities, okay, and have it's a very good lunch. So I think they enjoy, and also it's good for physically and cognitively probably, and socially as well. And for caregivers, it's free up the time for from 9 to 5. So I think particularly people who live alone and or live with spouse and also live with children who are working. I think it's the daycare services. I think it's a very good system for home-based. If you want to stay at home, okay, and not institutionalized. Yes.
Oh, thank you. Okay. I think now I should turn it over to you, Alan, for community questions.
And to Dr. Akiyama, as well as to the audience, we're fielding questions from the question and answer box, and Margaret and I are kind of exchanging questions to make sure that we're getting new ones and allowing questions from the audience. And this question has to do specifically with population aging in Japan, and builds on the point that you had made earlier about the dependency ratios in Japan kind of shrinking over time. Do you believe that Japan will be more willing in the future to accept more immigrants from other places to help address some of the demographic challenges, such as the increase in the need for caregivers and also for income, for work-related reasons?
Yeah, yes. Well, I think, for a long time, I think Japan is a kind of closed country, but it's opening up. So I think we need to open up, the market, the labor market. And actually, I think, now we have, many nurses and also home helpers, coming from other countries. But I think that's not really, ultimate solutions, because every country is aging. Okay. I heard, where I think, the elderly, the nurses from Czechoslovakia are taking care of older people in London, but then the people from Albania or some are taking care of older people in Czech. So I think now the population aging is global phenomena. So I don't think that is really the kind of ultimate solutions, so that is, but still I think Japan is definitely, I think, opening up the labor market. Yes.
Thank you. Yeah, very much for that. And just a quick check-in with Margaret. you see there might be some questions from the audience that are kind of emerging here. Should I ask the next question here?
Yes.
Okay. Yeah, this is also related to population aging in general, but the audience member asks, so the 100-year life society is also associated with a low fertility rate and rapid fertility decline, which is connected to the dependency ratios. Will active aging on its own and its social structure modification be enough to help address these issues?
Well, I mean, I think that, to us, the most, the serious, issues are low fertility rate. Okay, and still we don't have, it's a very effective solutions. Okay, and but in my mind, my view is, I think we have to create the kind of environment, society, young people who wants to have children and raise children, okay? And to create that kind of environment, I think seniors can do something. For example, in Kashiwa, now, both husband and wife, works in Tokyo. Right. Okay, and so at the daytime, only the seniors and children are there. Right. Okay. And I think the seniors can do. Where it's seniors can make that. The Kashiwa daytime at a safe place, even if something the earthquake last night happens. And also I think they can provide some kind of services, education, daycare center, for children, and also, the schools. Yes, yeah. Actually, this, I can talk about, about the kind of jobs, we created, the education, kind of related, the jobs are quite popular among seniors. Yeah.
Kind of emerging industry that is taking off from these supports and services.
Yes, I think actually they created after school programs, and for example, so see, I think the school ends at 3 o'clock in the afternoon, okay, and that they moved to after school program, and there for example, one senior, who worked, for the trading company for a long time. So stationed in the New York or Singapore or whatever, and he teaches, the English, but not for entrance examination. He teaches, okay, the English for everyday life and also for business. Okay, that's very popular. And also another man who worked, robot, the company, he created robot clubs, and he teach children to make, the robot by using Legos, toys. And that is very popular as well. And also, another person is the working at the kindergarten, or so I think some the parents needs to leave children even before the school kindergarten opens. So the seniors made a group, and they can welcome those children, and have set up some program. Until the kindergarten starts in, that's something like that. So it's I think actually seniors are very what that is one of the areas seniors are very interested in. Yeah.
It makes a lot of sense, right? We've talked here in Portland about looking at the aging population, not just from a needs-based perspective, but thinking about the assets that are our aging population and older adults. And you've given some great examples on how to engage post-career, whether it's through jobs or volunteering. That it makes a lot of sense to continue to pursue those. I apologize for this, Margaret. I'm going to jump in and ask 2 clarifying questions kind of from the piece. So one of the audience members had asked about how you define frailty. And I think in particular, were they talking, or were you linking that to the IADLs and ADL functioning? Is that kind of how you were measuring?
Yes. Well, I mean, I'm sorry. I mean, are you talking about the frailty projects?
Yeah, as pertained to earlier in your presentation, you're wondering how frailty was defined in particular.
Well, I mean, I think, we have, the physical frailty and cognitive frailty and social frailty.
Okay.
And so there is a kind of definition and also indicators. And so we assess, those frailty level at, using a lot of devices. Yes.
Okay.
Yes.
That's very helpful. And the last kind of clarifying question, or maybe this is a longer answer, but one of the audience members asked about the concept of engaged life expectancy. And I'm not sure if they were asking about that or active life expectancy, but are both of these concepts or terms things you're familiar with and would use in your research and project work?
Well, active life expectancy, yes, I think that is very similar. But I think it's the engaged means, I think for us it is very important. The people are connected to the society. Okay, and have some roles. Even the minor, and it doesn't have to be paid work. Okay, it might be volunteer or something you do every day. So it's kind of connect to the society, including family or the community or different level of the society, and have a roles. And I think there is a role. People have said thank you for that. Okay, and that kind of roles. Okay, and that is what we are imaging. When we say engaged life expectancy.
Thank you. It's a new term to me, but it makes a lot of sense. And I appreciate the audience member for bringing this to our attention and for your answer as well. Margaret, I'm going to turn it back over to you for the next question.
Okay, great. What trends in technology should we consider to better support older adults, people with disabilities, and their caregivers? So what trends in technology?
Well, I think, I think that about 10 years ago, I was, I attended, the government, national government meeting about, the future industry or whatever. And I talked about, the kind of industry, to support aging society. And then, the kind of presence on the top, the people at big companies said, well, yeah, that's, yes, I see what you're saying, but it's a minor things. And so it doesn't make any profit probably. That's what they said. But now I think everything. The companies in all sectors are really interested in and kind of developing the all technology. Using technologies. Trying to create. The age-friendly societies or something to keep people independent. Okay, so of course, the information technology, robots, and the sensor. Those are major things. But I think basically all kinds, the type of technology. So I think we can use. Yeah.
I'm going to ask a pair of questions that kind of go together. So there was one person who asked a question about, special areas of interest or attention in urban areas, and another person who said, rural areas are aging more rapidly. What kind of specific approaches in rural areas might we consider that are different than urban approaches? And so do you have any special insights about, urban versus rural?
Yes, as I mentioned, we have two, the site fields, of redesigning, communities, okay? And there are, most of the issues are common in both those two the fields. But for example, transportation system. I think transportation is more serious in rural area. Okay, in urban area like a Kashiwa, there is the public transportation. There are different kind of public transportations available, and so but in rural area, if you become a not, they can't drive. Are not able to drive. Actually, you can go to the shopping or healthcare. The hospital or visit friends. So it's there. The activities will quite limited. Okay, and in the other way, in rural area, I think most people don't have retirement age. In particular, in the agriculture. Okay. And so workplaces for the second life, I think they do have, most of the people already have, and and also they are more connected. They live in the same community for generations, and so isolation and also social isolation is, I think, the most significant problem in the urban area. I see, yeah.
And I have to follow up with one question here, but what is the silver vehicle? I saw this in your presentation. Do you have any additional kind of insight into what a silver vehicle is? Because it looked intriguing, the small one that was on your rural slide.
Yeah, it's kind of personal, the mobility. Okay, so, you can just be slow, the mobility, right. And you can ride to the shopping grocery and or clinic in the area. Okay, you can use them at the highway.
Yeah, not fast enough to get on the highway.
Yeah, but for everyday life, I think you can move around using this. But people don't like silver vehicle. The name silver is good. I think it's
right.
And now I think it's many Toyota, Nissan, every Yamaha make this kind of the personal vehicle, and but I think it's it's popular for young people as well. Particularly people with raising children. It's so it's not more universal, not only for seniors. Okay. So we don't call silver anymore.
Thank you. Yeah, that was an intriguing image that I saw, and I'm glad you could answer that. Margaret.
Yeah. Professor Akiyama, you've described the importance of co-creating with communities and also action research. Could you tell us a little bit more about co-creating with the community in order to best serve older adults? How can we work with older people to co-create our future community services and environments? And I want to draw from one of the questions from the community. Does redesigning for an aged society involve all generations? So in your co-creating work, is it only older adults, or is it all generations who need to have their perspectives incorporated?
Okay, well, let me answer from your last questions. For all generations. Well, when we start working in Kashiwa, I think we talked with different kind of people, from the government and also particularly residents, senior residents, okay, and also the people in shops and the healthcare people, okay, and then we kind of drew kind of the future picture, okay, and okay, let's kind of redesign the community in this way, and we put up the kind of the picture. Okay, and but kind of more focusing on the elderly, older people, and then we took it to the school, elementary school, and then the children got excited. Okay, I want a soccer field here, okay, or something like this, and so the older people want this, and the younger people want this and that. So I think it's really, it's the original picture, kind of changed, but I think it's it's really became, I mean, the community for all people of all ages. And actually children, I mean, also the 100 years life society, it's not only for older people, actually young people live for 100 years. Okay, they have a dreams how to live for 100 years. And I think then we have to redesign, I mean, to realize their dreams as well. So I think it's, I mean, a prospect for the new map of life, I mean, for 100 years, from children to old age, is very important. And also in order to, I mean, to work on even the very small projects, not only university can do, or government only, I mean, can do that. I think, I mean, it requires, I mean, kind of, I mean, co-creation or working together. It's, I mean, all different sectors. I mean, that is really, so once, and even, I mean, not only even the one, for example, academia, okay, we have a kind of, the vertical things, okay, I mean, College of Medicine and Engineering. I mean, we work separately, and even in the also in the government office, you know, some kind of vertical, I mean, administrative structure. So really, I mean, that is probably the biggest hurdle we had to clear. Okay, so in the beginning, I mean, in the university or in the city office, okay, we kind of started, I mean, kind of eliminating those vertical, I mean, structure. And then we worked with different sectors, like, I mean, Physicians Association and the government and the university, and particularly people. I mean, so it took time, but that is the most important. I'm sure that is, I think, Portland has been very successful in doing that.
Thank you so much. Just a follow-up question on that. What particular strategies could you recommend for breaking down those barriers, breaking down those silos, both within academia or within industry or within government, so that you can do that cross-sector collaboration?
Well, I mean, it is not easy, okay, and it takes time. And but I think, I mean, they are just, I mean, thinking back, I mean, and kind of, I mean, accumulation of small success. I think that's probably, I mean, kind of, I mean, strengthened our, I mean, the ties. Okay, so do something that even work together for small projects, and then, I mean, it's that's, I mean, the kind of small success. I think that's really, yeah, strengthening the understanding each other and also the trust each other. Yeah.
Thank you. Thanks very much.
I'm going to ask a question from the audience that relates very closely to some of the issues in Portland and other places in the United States. So when we did our 2006-2007 baseline assessment in Portland, the top barriers to age friendliness ended up being housing affordability and housing accessibility. And an audience member has asked, how is Japan kind of experiencing the housing market in particular from affordability and accessibility, and what changes are maybe afoot in the future? Okay, well, I mean, I don't know the exact number, but I think it's the current thing is 90%, over 90% of the seniors own the house. Oh, okay. But that's changing. Okay, I mean, see, I think, I mean, I'm a senior. Okay, I mean, when I was young, okay, when you graduate and get a job, for particular boys, okay, the first thing is they want to have a car. Okay. And then they're married, and next one is, I mean, have a own house before age 40. Mm. And the company also, employer helped that too. I mean, the system. So I think, I mean, the current older people, I mean, having a own house
that really means a kind of matured person. I mean, the real citizens. Okay, so and so I think also over majority of the seniors own their house, but I think it's maintaining house. It's something. It's because it is a different issue. So, but I mean, the owning house, I think it's internal. I mean, that's probably it's not the issue, but I think now younger people, they don't want car. I mean, it's also they don't have to have a house. I mean, because they want to move around. Okay, and so I mean, in the older generation, they have a house. I mean, suburbs of Tokyo, for example, or suburbs of any city, and commute to the workplace until they retire. That is, I mean, it's a very common pattern, but it has been changing. Okay, people, they might not stay in the same company, or they might have, I mean, the two places to live, and they don't have to own the house. That is, I mean, kind of attitude among younger people now. So it will be change. Yeah.
Yeah, I think trends are changing definitely across the world. It seems like. Are there challenges with respect to accessibility or kind of approaches to housing design that would be more universal or inclusive that are starting to take place in Japan?
Yes. Yeah.
Okay.
Yes. I mean, I think, I mean, because, I mean, we did not expect we live until 100 years. So, I mean, we need to reform. I mean, so we have to reform our house to, I mean, we can live, I mean, with until, I mean, 100 years. So I think, I mean, the reforming the house or moving from, I mean, the independent house to condominium. Okay, and it's very common. Yeah.
Okay, more accessible kind of features in the multifamily kind of high-rise buildings than there would be in single-family homes.
Yeah, right.
Okay.
So I think, I mean, traditionally, I think if you have a house, I mean, your children will move in, okay, and when you retire, also, but it's not that happen. That it doesn't happen now.
Oh,
okay?
right, changing.
So in suburban, I mean, like Kashiwa, the suburbs of Tokyo, I mean, single household, I mean, only elderly or elderly couples, I mean, lives in the house.
Okay.
So, I mean, in a sense, I mean, it's a kind of new phenomenon in Japan, but it's so that's really kind of new issues. I mean, how to take care, how to maintain the house. I mean, and also the kind of we have to design the condominium house means so that more universal design. So you can stay, I mean, in the same house for until the end of your life. I mean, because I mean, the government is promoting, I mean, home-based healthcare, and many people want to stay home. I mean, until you become frail. So the housing is very, very important. Yeah.
Thank you very much. And I just as a kind of little reminder, we're at about 10 minutes left. I think we may have questions for time for a couple more questions before we get the 3-minute warning to kind of wrap things up.
Well, I mean, can I ask a question?
Yes.
Okay. Well, I mean, I gave a talk about, I mean, the workplaces for the second life, I mean, in Germany about probably 6 or 7 years ago. And there, I mean, I got, I mean, a question, okay. Probably in Japan, you don't have, I mean, sufficient, I mean, social security system and pension. So that's why, I mean, the people wants to work, okay, after retirement, okay. I mean, why people want to work, I mean, after retirement? That was a question, I mean, for 7 years ago. And I think this 3 days ago, I gave a talk in Berlin. I mean, and then I think the situations are quite changed in Germany. I think, I mean, they are very interested in workplaces for the second life, how to set up okay, and something like that. I mean, how about in the United States? I mean, the elderly are they interested in working after retirement age?
Some yes, and some no. Some primarily because they feel like they need the income. They may not have saved sufficiently. And I would guess that our pension system, our social security system is probably not as generous as Japan's. But others want to work because for some of the same reasons that you talked about in your presentation. They want to work because they want to stay engaged. They want to use their skills, find ways to grow and learn, continue contributing, giving them a sense of purpose. So it's really both. I actually had a question that I was going to ask you and then decided not to, because it seemed like there was so much acceptance of the idea of working later in life. In Japan, my question was how much resistance is there? But it seems that there's not much resistance to working later in life.
Yeah, so I mean, as I show you the government data, okay, so 70% of old people wants to work until 70. That is, I mean, data is a little bit old, and then 40% they want to work as long as they are capable to work. Okay, and so and also, I think the labor force participation rate of people aged 65 and older is quite high in, I mean, international, I mean, high in Japan. But the reason for working after retirement age has been changing. Okay. Well, I mean, probably 10 years ago, I mean, people want to work, they want to keep healthy. And also have, I mean, kind of social connection, interactions, or something they want to contribute to the society with something more town. I think it's the major kind of reasons. But now I think the people who says because they have to work, I mean, for economic reasons, it's increasing. So I mean, because I mean. Because if you live for 100 years, it's a long time. I mean, after retirement, how you want to support? Okay, the savings might not be enough. I mean, besides, I mean, pensions. So yeah, I think economic reasons it's increasing. Yeah.
Is that your sense for why the people in Berlin asked the question about working longer?
I mean, the 10 years ago? I mean, 7 years
No, recently, the change. Why is the change because
I think my impression is, I think it's the working, I mean, after retirement age is more, I mean, acceptable. I mean, in Germany probably, because I think they dreamed about me, the kind of happy traveling, kind of retirement age. Right, but now in Japan says, well, if you play golf, I mean, every day or traveling, but for 3 months or 6 months, it gets boring. Okay, and you want to do something more meaningful. I mean, and that is a kind of very general feeling. Okay, of course you travel and you play golf. Okay, that's they do, but also they want to do something for meaningful. I mean, contribute to the society or have some roles, not society, but for families or the community. Yeah.
We have time. Go ahead. Thank you.
Yeah.
Do we have time for one final question, Alan?
I think so. We haven't got the 3-minute warning yet. One more?
One more. Okay. Okay. So what advice do you have for Portland as we witness the aging of our population while we prepare to be a city that's a great place to grow up and grow old?
Well, I think, I mean, this is really, we learned from Portland, but I think, I mean, when we, I mean, redesign, I mean, the society, and it's really based for, I mean, how people want to live 400 years. Okay, it's really related to new map of life. So we have to have, I mean, I think that, so the people are centered, okay, with co-creation, but I think, I mean, my impression is, I mean, when I worked, I mean, in Kashiwa, I kind of noticed, okay, residents, citizens has really know what the issues are, and also what the solutions are. Sometimes they have a good idea sometimes, okay? Then it might be very kind of primitive solutions way, I mean, but they have some kind of hint, we can solve it in this way. So that's the reason I created the Living Lab. I mean, so it's kind of people-centered and then multi-stakeholders. I mean, kind of innovation, I mean, platform for open innovation. And so people-centered, I mean, okay. So I think that's the only way we can kind of, create being the new and also sustainable and happy society. And actually, I mean, we would like to learn more from Portland. And I think you have been doing a great job. I mean, we have a lot to learn.
Well, thank you very much. And thank you for your presentation. It was fascinating.
And we are open to co-learning and to working with you. We're very excited to have this opportunity to learn from you today, but hopefully there may be opportunities in the future.
Yes.
Thank you, Dr. Akiyama.
Great. Well, thank you so much. I know the time is limited, so I would like to wrap up. My name is Yachi Isako. I am the International Program Managers and also the Director of First Stop Portland program at the Center for Public Service, Portland State University. To end this webinar, I would like to thank Professor Akiyama for joining us from Japan to share your years of your journeys and discoveries on how to co-create communities by engaging elder populations. And discussing this with Professor Neal and Dr. Deletori was helpful to think of the application to Portland and Oregon, which our center was really hoping to achieve today. So thank you to both the panelists for sharing your expertise with us. And in addition, I want to thank the Consular Office of Japan and the Bureau of Planning and Sustainability Office for collaboration and putting this event together. We were able to reach a large number of audience today to think collectively about this important topic. And the active audience questions show that this was a small success of a collaboration across the ocean. So thank you to all who were here today. And lastly, I would like to ask the audience to take 2 minutes to fill in the survey posted in the chat. And your input helps us to organize and provide other ways to create these types of learning opportunities in the future. So please give us your feedback and your best takeaways from today's learning. And we'll also send you an email with the survey link and after the events, and as well as a learning packet we'll put together for you to digest more. So it'll include Dr. Akiyama's PowerPoint and other PDFs shared today in the chat. So please look out for an email as well. Again, on behalf of the Center for Public Service at Portland State University and the team who put this webinar together, I want to thank everyone for your time and participation. Have a wonderful evening.